So thousands of healthcare workers across the country are striking for a second day in what their union is calling the largest strike of its kind in American history.
Who got the power? We got the power. What kind of power? Union power.
The strike began yesterday morning after negotiations between Kaiser Permanente and the union representing the health system's 85,000 employees fell through. More than 75,000 of those workers have walked off the job, demanding higher pay and increased staffing. The strike is expected to last 3 days. Our senior business and technology correspondent, Jo Ling Kent, is following the story for us from Los Angeles. Good morning, Jo Ling.
Anne-Marie, good morning. This is just the latest strike in the healthcare industry to hit this year. And while it doesn't include doctors, we're talking about licensed vocational nurses, x-ray technicians, and lots of other frontline workers. They're telling us they feel massive burnout since the start of the pandemic. And this, for them, is about the quality of care they can provide for their patients.
Some 75,000 healthcare workers across the United States are taking to the picket line.
Fighting for a fair contract.
Striking for higher wages and help resolving what they call staffing shortages. The walkout is affecting Kaiser Permanente facilities in 5 states and Washington, D.C. Some have worked for Kaiser for more than 2 decades, like administrative coordinator Joanna Isaiah.
What are you hoping to get out of this strike?
I'm hoping to get more workers to cover the staffing crisis. We have a lot of people who leave and they're like, why would I work here for the same pay that I can make at Burger King or Target?
The union is asking for a minimum wage of $25 an hour. Kaiser has now proposed minimum hourly wages of $25 in California and $23 in markets outside of the state. Kaiser's patient pool is nearly 13 million people, and more than 300,000 employees work there. Its profit so far this year tops $3 billion.
It's hurtful to know that as hard as we work for Kaiser, they don't work hard for us.
In a statement, Kaiser says it is committed to finding workable solutions to balance taking care of our employees and being affordable to our members.
We want a pension.
This strike comes amid intensifying labor disputes in other industries. Auto workers, Las Vegas culinary workers, and screen actors are all at the bargaining table, while groups like UPS workers and writers for the WGA came to agreements. Georgetown University labor historian Dr. Lane Wyndham.
Workers, when they are taking a stand, are winning, and that will simply inspire more workers to take a stand.
Now, this strike is expected to last until Saturday, and it could affect a lot of those non-urgent appointments like an x-ray or something like that. And what we do know is Kaiser says, despite the strike, their emergency services and pharmacies remain open, and they've got people coming in to work those shifts. But overall, if you look at it, the negotiation is still at a standstill right now. The two sides have not come to an agreement, but Kaiser says they are willing to come to the table in good faith until this deal is done. Anne-Marie?
Jo Ling, I'm sort of curious. We've seen the Biden administration kind of wade into these waters with other labor disputes, whether it was the railway workers, most recently the auto workers strike. Have we heard anything from the Biden administration in regards to this?
What we know right now is Biden has said repeatedly he is the most pro-union president, but there have been so many strikes, particularly in healthcare, over the last year. So this is an industry that's really hard hit by higher costs overall. And of course, the labor shortage that really exacerbates this, and it hasn't returned to pre-pandemic levels just yet.
All right, Jo Ling, thank you so much.